Hey guys, it's Dr. David here, physical therapist with Paso Manual Physical Therapy, and I wanted to explain to you the progression that we expect you to go through as long as everything's happening correctly. And what we mean by everything's happening correctly, it means we're doing our part, we're taking care of our responsibility on the physical therapy side by knowing exactly what's going on and what tissues are involved. Is it a disc? Is it a tendon, a ligament, a muscle, a nerve, cartilage? All those things have to be considered, or is it a combination of two or three or something like that? We have to know that in order to set the correct expectations for when you should get better. And then of course your responsibility is keeping up the exercises or movements or stretches so that both working together give you the best outcome possible for improving as safely and as fast as possible. So I'm going to draw you this graph here. You probably saw it in the clinic already, but just to review it here, you have time on the bottom, and then when you start with this, usually your strength is pretty low and your discomfort, pain, irritation are relatively high. So what we want to see over time is you get stronger in certain areas, whatever we discuss. It could have been your abs, your glutes, some foot muscles, some neck muscles, some shoulder muscles. We identified that for you here, obviously. So those muscles should get stronger over time, and then this will go down over time. Where these lines intersect is your pain threshold. And what we like to see, I'm sure you can't wait for this, is for this line, this discomfort, pain, and irritation line, to go below the threshold, right about here. At that point, you start feeling really good. You start having several days in a row, maybe even a week or two, where you feel awesome. We're not done yet. We're about 2/3 of the way though. We got to get all the way over here. So let's split this up into some phases. There's 3 big phases that we need to identify and see where you're at. Phase 1, 2, and 3. This is the acute phase, subacute, prevention, which usually entails a lot of strengthening. When you start with us, usually pain, discomfort, irritation's high. It's hard to do things in life like exercise or do stuff around the house or sit comfortably, walk comfortably. You're definitely in the acute phase at that point. So pain and irritation is going to be high, and it might take you a good amount of time to get along this phase here to where the line's going down. So depending on if this is a disc problem, a muscle problem, nerve, we look at that. The time frames are going to be different because different tissues heal at different times. And if there's a combination, then it's going to go by the slowest one, the one that heals the slowest. So right now, if you're just starting out with this, you are likely in phase 1, the subacute or the acute phase. So we don't expect you to have instantaneous relief. We expect to put you on the plan so that you're getting better gradually over time, and we can get into the next phase, phase 2, and then eventually phase 3. That's where you want to live, obviously. This is where we should all be normally. But you got an issue, let's deal with it and make sure we progress you. And by the way, this is how we progress you without having to rely on painkillers and without having to do surgery, because if your problem is related to strength, and we would have identified that here already, there's no surgery that's going to make you stronger. There's no pills that make you stronger either. You just got to do some reps, get some exercises in. But the question is how much, which ones, and that's what I'm here to guide you through. So make sure you do your exercises right now. These dots all represent times that you do your exercises so that this line starts to come down. In the acute phase, there's certain exercises that you have to do that aren't going to aggravate the problem more. But once we hit the subacute phase, then we can change the exercises. They get a little bit more aggressive, but you're gonna be better able to tolerate it. And then of course in the prevention phase, they're even more aggressive, but then you should be feeling fine by then. So if you're right here right now at number 1, make sure you do your exercises just like we ask you to, so that we can get you across this line into the next phase, so we can work on the next level of activity, so you can start to get back into the gym, get back into exercising like you like, get back to being able to do the things that you haven't been able to do because you've been in pain, you've been limited by what you can do.